Hello everyone, myself Shiny, lecturer, Triple College of Nursing. This video will help you to learn about antidepressant drugs. Antidepressants are those drugs which are used for the treatment of depressive illness. These are also called as mood elevators or thymoleptics. So, definition of depression. Depression is a mental illness characterized by pathological changes in mood, loss of interest, feeling of guilt or low self-worth, disturbed sleep, low energy and poor concentration. Depression is a common mental disorder affecting more than 264 million people worldwide. Everyone experiences sadness and unhappiness at some points in their lives, which interferes with a person's ability to engage in daily activities. So, antidepressants drugs used to relieve symptoms of moderate and severe depression. At least 4 to 6 months, patients should take antidepressant drugs, and also these antidepressant drugs can be used alone, or else you can take these antidepressant drugs with some other medications also. The main purpose of antidepressants is to increase the neurotransmitter levels in the synapse. Classification of antidepressants. Tricyclic antidepressants, selective serotonin reuptake inhibitors, dopaminergic antidepressants, atypical antidepressants, monoamine oxidase inhibitors. Tricyclic antidepressants have been employed in drug therapy since the late 1950s. This is the largest group of drug agent. Selective serotonin reuptake inhibitors is the safest antidepressants for use. First drug, fluoxetine, available from 1988. These atypical antidepressants, they are mixed group of agent, and this monoamine oxidase inhibitors for depressive patients from 1950 onwards. We are using this medicine. These monoamine oxidase inhibitors drugs are not widely used today, although a small number of patients appear to do better in monoamine oxidase inhibitors than tricyclic antidepressants. These are the examples of drugs for tricyclic antidepressants: imipramine, amitriptyline, clomipramine, dothepin, mianserin. Trade names are for imipramine antidep, amitriptyline triptomer, clomipramine anafranil, dothepin prothiadine, mianserin depnone. Imipramine, amitriptyline, clomipramine, dothepin, oral dosage per day 75 to 300 mg, and mianserin, oral dosage per day 30 to 120 mg. Selective serotonin reuptake inhibitors, fluoxetine and sertraline. Fluoxetine trade name is Fludoc, and for sertraline, Serenata. Fluoxetine oral dosage per day 10 to 80 mg, sertraline per day 50 to 200 mg. Dopaminergic antidepressant is fluoxamine, trade name Feverin, oral dosage per day 50 to 300 mg. Atypical antidepressant amineptine, trade name Surfactant, oral dosage per day 100 to 400 mg. Monoamine oxidase inhibitors, trazodone and isocarboxacid. Trazodone trade name is Trazolone, per day oral dosage 150 to 600 mg. Isocarboxacid, trade name Marplan, per day oral dosage 10 to 30 mg. Indication: depression, depressive episode, dysthymia, reactive depression, and abnormal grief. Here, this dysthymia means low mood occurring for at least 2 years along with two other symptoms of depression. And this reactive depression is otherwise known as exogenous depression. Abnormal grief is severe reactive depression and the excessive feeling of guilt. Childhood psychiatric disorders such as neurosis, separation anxiety disorder, somnambulism, school phobia, night terrors, and other psychiatric disorders such as panic attack, generalized anxiety disorder, agoraphobia, social phobia, obsessive compulsive disorder, with or without depression, eating disorder, borderline personality disorder, post traumatic stress disorder, depersonalization syndrome, and medical disorders such as chronic pain, migraine, peptic ulcer disease. So these are the common indications for antidepressant drugs. And pharmacokinetics. Antidepressants are highly lipophilic and protein bound. The half life is long and usually more than 24 hours. It is predominantly metabolized in the liver. Mechanism of action. The exact mechanism is unknown. The predominant action is by increasing catecholamine level in the brain. Tricyclic antidepressants are also called as monoamine reuptake inhibitors. The main mode of action is by blocking the reuptake of norepinephrine and or serotonin at the nerve terminals, thus increasing norepinephrine and 5-HT, that is serotonin levels at the receptor site. Monoamine oxidase inhibitors instead act on monoamine oxidase, which is responsible for the degradation of catecholamine after reuptake. Increase in brain amine levels is probably responsible for the antidepressant action. It takes about 5 to 10 days after this 5 to 10 days for monoamine oxidase inhibitors and 2 or 3 weeks for tricyclic antidepressants to bring down depressive symptoms. Then we'll discuss about side effects. These are the common side effects. So because of taking these antidepressant drugs, autonomic side effects such as dry mouth, constipation, cycloplegia, mydriasis, and delirium and aggravation. So these are the common side effects comes under autonomic side effects, and CNS effects are sedation, tremor, and extrapyramidal symptoms, and withdrawal syndrome, and precipitation of mania. These things comes under CNS effects, and cardiac side effects are tachycardia, ECG changes, arrhythmias, and direct myocardial depression. Allergic side effects such as skin rashes and agranulocytosis, systemic vasculitis, and cholestatic jaundice. These are the symptoms comes under allergic side effects. And metabolic and endocrine side effects are weight gain. Special effects of monoamine oxidase inhibitors drugs are hypertensive crisis and severe hepatic necrosis and hyperpyrexia. So these are the common side effects patient when taking these antidepressive drugs. The nurse's responsibility for a patient receiving antidepressants. So most of the nurse's responsibilities for a patient on antidepressants are the same as for the patient receiving antipsychotics. And patient is on monoamine oxidase inhibitors, we should be warned against the danger of ingesting tyramine rich foods. The reason is, so tyramine rich foods along with this monoamine oxidase inhibitors, it leads to hypertensive crisis. So we should advise the patient to avoid such foods. Uh, Beef liver, chicken liver, fermented sausages, and dried fish, and chocolate, beverages like wine, beer, coffee. So these things we should advise the patient to stop taking while taking monoamine oxidase inhibitors. Then we need to report promptly if accidental headache or nausea, vomiting, chest pain, or some other unusual symptoms occur. So because this will lead to hypertensive crisis. We need to instruct the patient not to take any medication without prescription. We need to caution the patient to change his position slowly to minimize orthostatic hypotension, and strict monitoring of vitals, especially blood pressure, is essential. That is very very important. So these are the nurses responsibility we should have in our mind. Still now we discuss about antidepressants and its classification, indication, pharmacokinetics, side effects, necessary responsibilities of antidepressants medication. So hope you all get little idea about antidepressants. Thank you.